Hi, Dr. Rehrig here again with another of my mini-series on your health and how we can help with your health needs. Today what I want to do is talk about something that a lot of people have been told relative to their neck or their back problems, and I just want to discuss a little bit about the situation and how we can help you with the famous, or infamous I should say, herniated disc. So hope you all can see this, but this is actually a disc. Discs are between all your vertebrae, and they actually run down the back of the spine, and you have about 50 of them. Basically they act as shock absorbers, and that's really good to protect your body and so forth. When the invention of the MRI came along, it enabled people to look inside to see the condition of the disc. And so if there's abnormal pressure on these shock absorbers, they have a tendency to bulge and begin to impinge on the nerve. Right here's the nerve. These are the vertebrae, and of course the shock absorber discs in between there. So if the disc begins to bulge too much, there is a potential of irritation of these nerves, and we call it a herniated disc. And again, it's one of the primary diagnoses if you go to a medical doctor especially and they see this kind of a condition. Now I want to point to something first of all, and that is that a disc may actually be a problem. Oftentimes, however, it's not the problem, and I'm going to show you why I believe that's the case. As a chiropractor, I always tell patients I'm a structural engineer for humans, and I'm picky. I know where all the parts should be, literally from the bones in the feet to the top of the head. So here's my little teeny mannequin here, and I show this guy because this is basically representing what normal would be. We look at this guy here, and this would represent what abnormal would be. So which one of these guys, considering these poor little shock absorber discs, one of these guys, or which one rather, do you think would be putting more pressure on their shock absorber discs in their back or their neck? You don't have to answer, I think you know. So my point is, many times the problem with discs is that it can be a problem. But rarely do I find, after 35 years of working with people who have back problems and neck problems, rarely is it the problem. The problem is that we've been walking around like this guy far longer than we realize, instead of looking like that. So to help the little shock absorber discs, what we do is we take bodies that look like this and we get them eventually to look like that. That helps to decompress those squished little discs, gets it to the point that they can heal again. And oftentimes people who have been given a diagnosis of herniated disc, actually the pain can be relieved and they start to feel better and resume normal life. So before you kind of give up and think, well, I have a disc problem, no one can help, I would recommend you call 610-566-9040 for a free consultation. You can come in and talk to me about the problems. You can bring your MRI results, and I'll talk to you and give you my opinion about what you may be able to do to help yourself and get rid of the pain that has been limiting your life probably longer than you would like. So nice talking to you, and I'll see you next time around.